Good morning. I'm going to call this meeting to order. If we could please stand for the Pledge of Allegiance and salute to the New Mexico flag.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I salute the flag of the state of New Mexico, as the symbol of perfect friendship among united cultures.
Okay, moving on to the next item on the agenda is approval of the work session agenda.
Mr. Chair, I believe that we approved the work session agenda.
Second. And discussion. Okay, all those in favor?
Aye.
Moving on to next item is the county reports. Grant County Detention Center monthly report. Mr. Carrillo.
Mr. Chairman, Commission members, respectfully submitting my report for May 7th, June 4, 2019. I'd just like to call attention to the graph that I attached to my report, the special management. Let's just kind of give you an idea of how many individuals that we're having, in special management. That number will change daily, but we do have a step-down process, and I just wanted to kind of keep you informed about our special management inmates. If there's any questions, Mr. Chairman.
Any questions? Questions, Commissioners? Commissioner Salas, any questions?
No, sir, not at this time.
Thank you.
You're welcome, sir.
Mr. Moore.
Thank you, Mr. Chairman, Commissioners. We completed our LGRF chip seal projects last week. We should have them all swept off by tomorrow. And then I'll just have to wait on the stripers to get down there to stripe the roads, and they'll be complete. We started prepping Rosedale Road yesterday. We'll probably be working on it all this week. Hopefully start milling on it next week, so we can start getting that big project started out there. Other than that, it's just business as usual down there.
Thank you. Any questions?
Yeah, Mr. Moore, question, I saw in the paper the announcement of chip sealing and shoulder improvement work being done out on the ridges. Mountain View, Skyview, Ridge Road itself. You're looking at me like you're not going to be able to answer my question. Maybe we should get together.
That wasn't the city?
Well, I thought it was from the city boundary to end of project, so maybe I misread that. If that's correct, if it's the city, then I will go.
I know that they've got a project planned on Ridge Road. I don't know exactly when they're going to start.
All right, I'll go ask them then.
Okay, I am planning, I think, on the resolutions that are on the agenda for this week. That does include some chip sealing down there that we didn't do when they were doing the water project.
Right, I remember we put it off.
Yeah.
And so now that was actually my question number one. Is this what we put off 2 years ago?
Yes. As far as going on the county maintained roads.
Okay.
That are over there.
All right.
And then
Thank
does
you.
the project include the widening?
That was why I was asking the first question. Because if it's what we put off, then it does not include the widening. I've already mentioned that to you. I still want to see Ridge Road be a full standard 12 feet per lane.
Okay.
Yeah.
I'm working on that.
All right.
Okay.
Any other questions? Thank you.
Thank you, Mr. Chairman, members of the board. Just talk a little bit about wildfires. We've got several burning in the Gila, none really in Grant County, most in Sierra County, and there's one in Catron County. The biggest one is a spring fire. It's probably a little over 3,000 acres right now. But again, there is a prescribed burn in El Pasture in the Ingress area. That's the only one really burning in Grant County, but that's a prescribed burn. They also did a prescribed burn in Cannon Creek, which was north of Fort Baird. It's about 900 acres. That's been wrapped up. But with the fires going on, that's up to fuel sales for us at the airport. So we're working diligently out there trying to making sure that we keep the aviation fires filled up. So they do have a Type 6 Columbia helicopter, which is the bucket drop. They have 2 seats, which are crop type duster planes that they drop suppression down. There's a helicopter express, which is the medical helicopter that they have, as as well. Repelling team is there now too. Don't ask me what that is. It's my first time I've heard about the repelling team, but they've got their airplane there along with fuel. And then of course the smoke jumpers are there now, but they're on that spring fire, so they'll be coming in and out. I am wrapping up the wildfire risk reduction grant program for education. We're going to do a complete media blitz. I want to thank Alicia for planning and working with me to get some print media, also some radio ads, social media, and stuff like that to try to wrap up the grant funding and get the educational being that we're in a high risk now as a Forest Service. As you know, we're in the high risk area. We did have, from the volunteer side, we did have a structure fire Saturday, which was in Arenas Valley. We had a manufactured home that pretty much was abandoned and burned to the ground. So I want to thank Whiskey Creek was the lead agency on that, along with Fort Baird, Tyrone, Santa Rita, and we also had assistance from Santa Clara and the city of Baird. So I want to thank those agencies as well for coming and helping. Go to Caminos will be working rodeo this week. It's $2 round trip from the conference center. I think that we worked with state police and sheriff's departments, kind of just making sure that we keep as less traffic in that area as possible. So we've been doing this for probably over 20 years now, I believe, having the routes run from the convention center. So I want people to know it goes from the convention center to the rodeo grounds and then back for just $2. So that's a pretty good price. But Tom Park just continued doing the daily maintenance on that, working on the area where the grass is and the flagpoles are, putting some new sprinkler systems in there and keeping that thing going as best we could. Other than that, unless you have any questions, that's all my report I have.
Any questions?
I do. Mr. Villa, so you're in charge of Correcaminos?
I oversee the director of Code of Communals, yes, sir.
Okay, and this is for my education. Correcaminos, those employees are county employees? Because I know the funding is a little different.
Yes, sir, they are.
Okay, that's all.
Randy, last week sometime I was up at Baton Park with Representative Dow, and I know I talked to Shardine a little bit about it as far as the weeds. Are we planning something before they get out of hand?
Yes.
or-
Yes, sir. Yes, Mr. Chairman, we're working on that. We're getting the weeds as best we can now.
Sounds good, thank you. Any other questions? Thank you.
You're welcome.
Thank you, Chairman and Commissioners. Just going off my weekly report. So for the Phase 2 on the old jail, the brownfields, some funding got announced that New Mexico Environment Department and the COGS did receive some federal funding, so that is good for us because we were one of the lists for the Phase 2 on that. So that's going to help us move that forward on the brownfields. National Park Service, I'm not going to hit much on this other than the presentation will be at the regular meeting on Thursday from the National Park Service from that qualitative survey. Infrastructure Capital Improvement Plan, I do have a draft ICIP that I hope to get out this week, so you guys can just start looking it over because we're going to need to get moving a little bit faster on that as we get closer to the July meetings to get everything prioritized. So if there's anything else that I miss, which happens quite a bit, let me know, and I'll make sure to get it on there after I send the draft to you. The Whiskey Creek Volunteer Fire Department, the metal building, on Thursday last week before I left for the weekend, it was almost completely erected, so that is back on track and moving forward. The sewer is complete on that, and so that's part of the Rosedale Road Colonias project. We're going to have the kickoff meeting, I think, is scheduled for this Friday, so we can get started on that. I know Earl's talked a little bit about what he's already doing down there, so we'll get that project moving on Rosedale. The census, we met on June 4th with the Complete Count Committee. Our next meeting is set for July 30th. Paul Doolin is no longer with the Census Bureau, so we had another lady out of Doña Ana that came up and met with us. She's covering it for now until they can get somebody else hired. Not a big deal. We do have the chairs that decided to step up is Curtis Clough from the schools, Sheila Hudman, and myself. So I don't really know if we call it a tri-chair, but we're going to be kind of running the meetings that way. And then Lori Bonomo from Skywest Media is going to help us out with taking minutes. So. Talked about Roselle and Tyrone ADA, the Colonias, just trying to get things moving on that. I'm hoping to have the contractor have the bid packets out and us have this completely bid and ready to award by the time we get the funds, usually in that August time frame. And then I don't know if we already talked about this, Randy may have hit it, but he received the $15,000 another grant award to continue with the CWPP. So we have to update that every so many years, and Randy and I applied. That's part of the same funding that he's just finishing up with the education on fire. So the CWPP is the County Wildfire Protection Plan. So we received $15,000 to update that. So that's my report. If there's any questions.
Thanks, Misha. The CWPP, that is the plan on what we're going to do in case of a threatened wildfire, and it's updated every how often?
Well, Mr. Chairman, Commissioner, it's not necessarily that. It's a report of where Grant County stands as far as high-risk areas, but it does have a lot of information there. You're right as far as emergencies and where to go, but it's basically an overview of Grant County of where our high-risk areas are, where our resources are, where we see mitigation, and that's the reason why I like to. It's a what is it? Open document to kind of
it's a working document.
Working document to kind of get feedback from the public. Very hard. I mean, we didn't get much feedback because there hasn't been really a major fire that's affected people. At that point, then you'll get people really interested. It's sad to say that, but it does have all the information as far as where our high-risk areas, where we go, emergencies, and and all the agencies play a role in this. So if you look at all the signatures on there, every fire agency is included in the document as well. So it's every 5 years it has to be updated.
And so one of the things we could get out of that report is if we needed more work on wildfire interfaces in populated areas, that would tell us that.
That is correct.
Okay. Thanks.
Any other questions? Thank you.
Thank you.
Any other county reports? Okay, moving on to the next item on the agenda, purpose and public input. The general purpose of the county work session is to inform the Grant County Board of Commissioners of the agenda items that will be addressed at the next regular meeting, and for the department heads and other elected officials to communicate with the commissioners in regards to matters in their respective departments. In accordance with Grant County Resolution number R-19-01, we welcome public input limited to agenda items only and will be limited to 5 minutes per speaker. Do we have anybody for public input? Okay, seeing none, we'll move on. Thank you. Next item is presentation and reports. Gila Regional Medical Center reports. Taffy.
Mr. Chair, Commissioners, thank you so much for this opportunity to meet with you today. I brought some people that I really wanted to introduce to you because I've been talking about them for quite some time. And the first one I would like to present to you is Dr. Butch Rosser, our new surgeon. Dr. Rosser.
Thank you, Ms. Taffy. God bless you all and for all the great work and the service you do for this county. A lot of people who look at my profile and the global impact I've had, they say, what in the world are you doing here in this beautiful community? I held court at Daylight Donuts today, met a lot of the folk, and I'm going to tell you the story I told them. All of my life, I may have had a high profile, but I was born in Moorhead, Mississippi, in the Mississippi Delta with 2,500. Always wanted to be a small town doctor that knew when the calves were born and how the chickens were doing and how your grandson was doing in school. You know how life is, it can take you different places. And now that I've had those 5 children and they've all been educated and they're out of the house, I can do what I want. And I chose to come here to this great community. My wife and I love the high mountains, and I really want to be of service the rest of my career. And all over the world that people have heard me lecture, I've talked about small communities need to have cutting edge medical choices. You shouldn't have to leave home to have good care. And I'm going to do my best to really thank you, Ms. Taffy, for giving me a chance for fulfilling a boyhood dream. God bless you.
Thank you. Welcome.
Welcome.
Thank you. Thank you, Dr. Rosser, and we're thrilled to have you here. Our next doctor is our new pediatrician, Dr. Andre Borel.
Thank you, Ms. Taffy. Good morning.
Good morning.
Mr. Chairman, Commissioners. I want to just say it's a pleasure and an honor to be here this morning to speak with you. Just giving you a bit of background on myself. This is actually my 3rd stint in your great state of New Mexico. I came here about 8 years ago and worked with the Indian Health Service, Northern Navajo and Ute, the Northern Navajo Medical Center. Actually, this is where I met my wife. And then I took on a trip. We went for the last 7 years. We went through working with other Indian Health Service in North Dakota, Oklahoma, and then they moved me up to Fairbanks, Alaska, to move with the U.S. military. So I had a great pleasure of serving as a civilian contractor, serving the military at Bassett Air Force, Bassett Army Base, and also IELTS. And then my wife, after we moved to the state of Tennessee, when it came time for us to move again, she said to me, "You've moved me long enough. It's time for us to go back to New Mexico," because she happens to be the caregiver for my 2 in-laws. My father-in-law is 91. My mother-in-law is 84, and she is the primary caregiver. So wherever I've moved her, she's had to fly back and take care of family business. So here we are in the great state of New Mexico. I am thankful to everyone who has been instrumental in bringing me here. And like my colleague, Dr. Rosser, I was born in a small community, the island of Barbados in the Caribbean. So I too love the honor of serving in small communities. I've served in cosmopolitan, I've served in rural communities, I've served among the Amish, Mennonite, Native American, Hispanic Americans. Like I said earlier, I was a civilian contractor with the U.S. military. I have a great deal of respect for our military and all that they have been going through, all the sacrifices that they have been asked. And I know that we living in rural America go through a lot of sacrifices as well. We may not have the benefits of the high tech that you have in the cosmopolitan areas, but as my colleague said, there's no reason why you should have to leave here and go elsewhere to have cutting edge medical care. I pledge with your support to give of my very, 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 very best. Thankful again to Healy Regional Medical Center and all those kind people there for their wonderful reception and bringing me to serve among this population here. My wife, I may add, is a volunteer. She's volunteered with prison ministry. She's a substance abuse counselor, and we are looking to get her plugged in here as well too. I visited a few of your fine churches in the community, and we're looking to find a church home. So if any of you have a recommendation there, I'd be lending a listening ear. Again, thanks to you all for the kind and work that you do. many times people who serve in public service do not get the praise that they deserve. Thank you, and God bless.
Thank you.
Thank you, and welcome.
Thank you. Mr. Chair, they would like permission to come up and shake your hand. Is that all right, sir?
Yes,
Thank you so much.
Also formal. Sorry that we're late.
You got to touch people.
Pleasure meeting you.
Welcome to our community. Welcome back to New Mexico.
Thank you.
Welcome, Doctor.
Thank you. Thank you. May God bless you all.
Thank you so much, physicians, for coming to our community. And I think that this is a very special time for us, and I think it's a time to rejoice. The next person I'd like to introduce is Dr. Rennie Mariscal. Rennie is the practice administrator for all of our clinics, so I'd just like for him to come and just say a few words.
Good morning, Mr. Chair and Commissioners. It's such a pleasure to be here. I think the common message that you're hearing is it's all about service. Well, my career began many moons ago here in Grant County at Hillcrest Hospital. And so now it's time for me to give back to our community and to serve in this capacity as physician practice administrator. And our goal is to provide services to our community here in Grant County, not those that already have a medical home, but those folks who are leaving our county to go receive care in other parts of the state or in neighboring states. So we want to offer choices of multi-specialties and services and programs. So again, it's all about service, and I'm so honored to be part of this. Thank you.
Tell them a little bit about yourself, Rennie.
Once I graduated from nursing school at the University of Arizona, I came back and worked as a flight nurse and ICU nurse for 2 years, and then I went on to become a nurse anesthetist. After several years of being an anesthetist, I became a practice administrator for a large network of surgery centers. And so eventually I went into administration and worked in the managed care organization, and then went on to work for CMS as an auditor to make sure that the Medicaid and the Medicare populations were receiving the care and access to care that they should receive. So I came back from Hawaii to come take care of my parents, and I fell in love all over again with this awesome community. And I hadn't planned on staying, but I got hooked, and here I am.
Thank you. Thank you very much.
Thank you. Thanks.
I think one of the things that I would like to ask of all the commissioners is that from time to time, at least one of you come to our board meeting. Our last board meeting, we changed it around a little bit. Instead of my talking about things, I brought directors that have responsibilities for these departments so they could really share what they were doing with all of the participants. I think it was a great success because you get to hear the heart and soul of the people that are really working in our organization. And these people have great responsibilities, as you can imagine. I can give you bullet points, but they are really the ones that are there day in and day out, and they're the heart and soul of our hospital. They work with the men and women on a daily basis, 24/7. They're always there, and they're totally committed to improving the health care of our community and working with other agencies to make sure that that does happen. So instead of going into a lot of rhetoric, which I have so known to do at these meetings, I will just open it up for any questions that you have.
Do you have any questions?
I would just say that I appreciate the invitation. I think it's a great idea that you're having directors report. I look forward to hearing from them, and congratulate you on Dr. Rosser and Dr. Worrell.
Just to add to that, we also have hired another family practice physician from Maine, and she should be starting in about 3 months also, once she retains her license. So I'll turn this over to Richard.
Okay, good morning. So this is the financial report for the month of April, which is 10 months into our fiscal year. So in a nutshell, for the month of April, the system generated a $60,000 profit, which brought our year-to-date profit to $85,333. EBITDA for year-to-date wise, we've spun off $2.44 million in cash flow. And if you take a look at the year-to-date 2018, you see we have $4.5 million. But that was the month of April of last year. We received a roughly $4 million safety net care pool payment in that month, and that's what generated that wide variance. Our cash collection percentage is still currently remains at 30%. Our cash to net revenue collection for April was 124%. I believe this month it's going to be around 132%. So we're continuing to catch up on the collections of some of the older accounts. As I believe I may have reported last month that we have filed and have been notified that for fiscal year 15 and 16, we were going to receive approximately slightly over $2.4 million. A couple of weeks ago, we did receive formal notification from CMS dated May 15th to that effect. So CMS has 60 days to reopen the cost report, implement the changes, and issue the check. So we're looking forward to receive that cash sometime in July. We've also submitted the 2017 declining volume request, and I should be able, if I have time today, to finish the 2018 request, so we'll be fully caught up on that. Another big project we've been working on is, and we've discussed this in the past, is the transfer DRG project. So the vendor has received all the data and is culling through the data now, so we expect to see some action on that this month, first part of July. We did present our operating and capital budget to the board this past board meeting, and it was approved and has been submitted to the state. We have hired a new controller for the system, Jennifer Klotz. Jennifer comes to us from West Virginia, from a hospital in West Virginia. Jennifer spent a part of her childhood, her parents were, her father was in the military, so she spent a part of her childhood in Las Vegas, Nevada. So when I was interviewing her, she said, I've had enough of the heat and humidity of West Virginia. I'm ready to come back to something I like better. So she landed last week and is hitting the ground running very hard. So on page 2 of the report, you can see the volume of the charges, but I do want to comment on our days cash on hand at the end of April was 31.5 days. Our days in net AR is 44.6, and our days in accounts payable was 20.5. Today, our days cash on hand is 28. It's up a little bit from yesterday. So we're continuing to modify how we manage our accounts payable, and of course we put a lot of effort into our AR over the last year. So now we're turning our attention to AP and how do we properly manage that. So that process is coming along nicely, as you would expect when you look at in a particular area. You expect to find some areas of improvement, and we have, and we are. So again, our year-to-date profit stands at $85,333. Is there any questions?
Yeah, so explain to us about the days of cash on hand we know recently, and appreciate the weekly report we're getting from the chair of the Board of Trustees and the heads up that, the detailed heads up that we got from him. If you could explain to us about the days of cash on hand, how that got, maybe how that got away from you, or how it didn't, but seemed like it got away to me and some of us maybe. And seems like we're going back up to 28's a good improvement, one over yesterday, and seems like it. What was it? So could you just give us a detailed explanation of all that?
So, you know, days cash on hand, depending on the time that you look at it, it's just like looking at an EKG. It's going to go up and down, up and down, up and down. Now, when this first hit, we had just completed the third payroll. We have 2 months of the year where we have 3 payrolls in a calendar month. So we had just hit the third payroll in April. May, yeah.
I have to help him with finance once in a while.
Yeah. So, you know, anytime you have, you have those kind of days, those kind of events, it's going to drive, like payroll this week is Wednesday, Thursday, cash on hand is going to drop 5 days. That's just how it works. So one thing that, as I stated earlier, how we manage our accounts payable, because the way I calculated it this past month was, we're at 20 days. That's absurdly low. So we're going to be managing how we pay our vendors and be more realistic in hitting the due dates instead of, we had lots of areas of improvements there. So. But that's really kind of it. Now, what we were doing in the past also was we would accelerate our accounts, our payments at the beginning of the month. So we would have big accounts payables at the beginning of the month, and it would trail out to the end of the month. Now, what we're doing is we're taking a set amount of dollars, and we're paying every Friday. We standardize our AP day to Fridays. And we're going to spend about the same amount every Friday instead of, way up front and let it trail. So it all goes to how you manage your vendors.
Can you tell me? So I see in 2018 your AP was 56 days out, compared to at the end of April 20 days out. So that's 36 days. I should be able to figure this out. How much is a day of AP?
A day of expense is $190,000. So AP is less than that, and I'd have to calculate that, Mr. Billy.
Okay, so I wouldn't be able to figure that out.
Yeah.
Okay,
but it's a lot.
That gives me a rough idea then what you're talking about. So you're paying your bills on time. I'm trying to put this simply where I can understand. Well, so you're paying your bills quicker and on time, and so that's taking a bite out of your cash on hand.
Well, yes and no. We were paying some vendors really quick, and we were paying some vendors not so quick. So the process that we put in place is to put all the vendors on equal footing, and depending on the due date of the invoice, that's how we determine what we're going to pay and when we're going to pay it. So for instance, I'd like to stay somewhere between 30 and 40 days in AP. HCA, I think, they run their operation at 45 days. And a lot of the for-profits stretch it out between 45 and 60 days. But my goal is to keep it somewhere between 30 and 40 days.
Okay. Thank you. Thanks.
No, he answered the question that I had.
Well, just as taking a first cut, because I can't resist trying to figure this out. Your AP is basically everything, all your expenditures except your payroll, right?
Pretty much, yes, sir.
Just as we're doing a rough figure here.
Yeah.
And do you have a sense of what percentage of your expenses are payroll?
About 55% of our expenses is payroll.
So days AP would be a little less than half of days.
Yes.
cash? I mean, of
Yeah, so
expense.
probably about 30% of our expenditures were related to AP.
Okay.
And the rest being employee benefits and insurance and stuff like that, which were still kind of run through the AP system.
So roughly 3 days of AP reduction is 1 day of operating expense reduction.
Yeah, I can't calculate on my feet like that.
That sounds about right to me, Mr. Billings. If they drop AP by 21 days, they've spent 7 days of cash, roughly, right? This is all extremely rough.
Yeah, about 3 to 1, yeah. Extremely rough.
Right.
All right.
All right.
Thanks.
You know, for me, I really appreciate it. It's great to have this financial report, but, you know, and I will ask that maybe next time we meet, I'd like to see where you're at. You know, I've seen some of the strategic plan that was put together. I'd like to see or get a report exactly, you know, where you're at on that and what's being done with that.
Yeah, so I can give you an update on 2 major initiatives within the strategic plan underneath my umbrella. I can give you an update right now on that.
That'd be fun.
So I want you to understand also that, you know, 2 months ago, we were informed that we're not going to get the $9 million we expected. You know, that's just a reality. And we have so far been unsuccessful in getting any relief from that. Having said that, you know, there were decisions made that, you know, hindsight is pretty doggone clear. So there were some decisions made we may not have made having known this, that did have an impact on cash flow, and so we're dealing with that now. Now, obviously, we didn't go completely without abandon. I mean, we were trying to be conservative in the endeavors we did undertake. So, having said that, so we really have to deal with, you know, the loss of $9 million. So, you know, we are dealing with that now. The 2 major projects on the strategic plan had to deal with converting our primary care practice sites to a rural health clinic. That project is, we have contracted with a company to provide guidance on that process because it is a process. We have received notification from the licensing department of New Mexico Health telling us to proceed, so we're on that road. We've met with the vendor several times now. We have submitted all the data necessary that they have requested. In fact, I believe we had a 48-hour turnaround on all the data requests. So that project is starting to get some steam underneath it. The big thing about that particular project is not only are they providing us a roadmap to follow, but it's a roadmap that we can duplicate as we open additional primary care sites. You know, and primary care is, you know, has a fairly broad definition. It's not just family practice, but, you know, it's also other types of practices like I believe podiatry is also, but I'll have to check on that. And that's one of our questions, to make sure we get a good list of what qualifies for a rural health clinic. So we're moving down that road. We've also contracted with a group to provide guidance on a critical access conversion. And this is an important update on that. So we've had our first meeting. They've asked us for some data. We have submitted the data. We've given them access to all of our cost report record from our cost report preparer. So we are moving down what we call phase 1, and that is that's an analysis of the appropriateness of converting to critical access and the pros and the cons. Now, one thing that I quite frankly just forgot that they brought to my attention again. You know, at some point we were talking about the need to have $5 million in the bank to do this conversion. Now, during our initial conversation, I posed all these questions to them, and then our second conversation, they said, "Well, you do have the ability to continue billing through the critical access designation phase, which is probably what we would do if the board decides to go down that road. So what we can do, what they'll allow us to do is to continue billing under our current Medicare provider number. Then once the critical access designation becomes effective, then we will have to reverse all those bills that we sent from the effective date of the critical access designation to current. And then we'll have to rebill it under the new critical access number. So, so I was speaking to someone else in the hospital yesterday, I believe, and they said, isn't that kind of bad that you have to reverse and rebill? I said, no, it's not really. One, the physical intermediary, Novitas, will be aware that's what we're doing because we're going to tell them that's what we're doing. Second of all hospitals across the United States cancels bills and resubmits them. So it's nothing unusual. But it does require a right good bit of work on our end to accomplish that. So, we're well on the road to both of those major projects. Now, again, I'd like to remind everyone here, especially the press, that critical access is basically a reimbursement methodology for small hospitals in rural areas. And that will be the deciding point. Is what is the critical point that we have to be concerned with? And it really is just for our purposes, simply a reimbursement system. Now, there is some impact on the Medicare beneficiaries that we're aware of, that we've had discussions about. We are addressing those, and we have already started addressing those issues to mitigate that impact. So that's kind of a brief update on where we are on those two major projects. And I know we'll be, and I don't want to speak for Ms. Taffy, but I know we'll be having an update to our board on where we're at on the strategic plan in a week or so. And then we'll see you guys.
Any questions?
Yeah, I feel like I may have missed something. You alluded to your previous estimate that you need roughly $5 million to weather the roughly 3-month billing gap. And then you explained how it's normal to cancel bills and resubmit bills. I guess I expected another shoe to drop and for me to find out, oh no, you don't need $5 million, or it's not going to be a 3-month gap or anything. Did any of those things change?
Well, if I continue to bill, the cash flow will still continue. There will be a short gap in cash as we cancel bills.
As we cancel and resubmit it.
Yeah, as we cancel and then resubmit. There'll be a gap, there'll be a window there.
But that's a month, not 3 months.
Correct.
So we're looking at less than $2 million now.
Yes, sir.
Of working capital that you need.
Yes, sir.
Well, that's great news. Thank you.
So what about the fact that there's been some discussion in the healthcare, like modern healthcare and those sort of publications about the fact that funding for critical access is potentially shaky. So what if you go through, and maybe let me just back up one step. So when you go through, so you're currently licensed as a 68-bed hospital, correct?
Correct.
And once you go through the critical access process, then that changes your licensure?
It will.
Is that true?
Yes, ma'am.
And so if then critical access, the funding that makes critical access work, the federal funding that makes that work goes away, then is there a point in time where you would need to consider relicensing at a higher, how will that affect your long-term licensing strategy, I guess is what I'm asking. And then there's maybe a second part of this question that you could answer at the same time, and that is, it's my understanding that in the number of beds that critical access requires, that does not count, just lost the word.
The behavioral health.
OB, thank you.
Yeah.
and behavioral health.
Okay, so, all right, so let's talk about the funding first. So critical access status has been around for probably 20 years, and for almost 20 years there's been discussions about, what if critical access funding goes away. There are some initiatives in Congress, even today, and have been for every year, to actually increase the funding levels for critical access hospitals, because if you look at the hospitals across the United States that have closed, a fair number of them are critical access hospitals. And there's a reason for that. We won't go into all that today, but you need to understand, if you don't manage the cost structure in a critical access hospital, you will get crushed. Now, having said that, Dan over here is the FQHC, and they receive federal grant funds. During the Obama administration, there was a massive expansion in funding for community health centers. That will not continue, most likely, at the level that it's been. I don't know, and I don't really follow it. I don't know if there's been any changes. Dan says it's going up, so good. As everyone in this room knows, anytime you rely on the government for anything, it's subject to change depending on how the wind's blowing at the state capitol or Washington, D.C. So all we can do is, look with best available information, look ahead to anticipate some changes. I don't personally anticipate massive changes to the critical access rule. They might announce something tomorrow that I'm not aware of. But if I personally felt that that was a risky move, I would so advise the board and Ms. Taffy of that. As far as the bed licenses, we are licensed for 68 bed under critical access. We will move that down to 25. I think in the past year, there's been 2 days where we've actually passed the 25 bed mark for acute care patients. Now, behavioral health unit is what they call a TEFRA unit, which is separate. It's almost like a entity within the hospital. So it stands on its own. Those beds we will have the 25 beds and the 10 bed behavioral health unit. Now there's some questions on the state level on how they're going to look at these TEFRA beds. And we're in the process of discussing with the Department of Health. We've already posed the question, how would they view that for purposes of safety net care pool calculations, because that's going to make a difference. So Russell Toll we've posed the question to him, and he knows us. He knows we're going to formally ask in the very near future. As far as OB is part of the hospital. It is included in the 25 bed. The nurseries are never counted for the cost report or the safety net care pool. Nurseries never count, but the moms do.
So moms count, the babies don't.
Yes, ma'am. Yeah.
So, going back to the safety net care pool question, then your question, as you're told, then has to do with the fact that are you going to be 30 beds and under or 30 beds and over?
Yeah, 25 bed. Or we're going to be
BH with the.
Yeah. Is that
so the cutoff for the safety net care pool is 30, and so are your 10 BHU beds going to put you over that limit? That's
yes,
your
ma'am.
question.
That
then.
is the question. Yes,
yeah.
ma'am. Mm-hmm.
And I want to just go backward for just 1 second on the rural health care clinic. Is that a federal designation or a state?
It's actually, it's a federal designation that the state follows on to.
So the decision will be made at the state level?
It will be made by the Department of Health on behalf of CMS.
Okay, thank you.
Mm-hmm. So also,
Department of Health or Health and Human Services? I'm sorry.
Yes.
Right.
You know, I'm used to calling them Health and Human Services, and that's a big umbrella over all of it. So I'm not sure if New Mexico follows that same nomenclature. But there is something really critical here that we need to understand. You know, so under the rural health clinic designation, there's two main areas we need to give consideration to. One is to be classified as provider-based, and that there's some implications of that. That means it's a department of the hospital versus freestanding. So that's a consideration that we need to explore and have a full understanding. The second is there's an exception in the Medicare regulations that allow hospitals under 50 bed to become cost-based reimbursed. Now, this 2018 cost report, we reported, I think it was 43 available beds. So we're under the threshold. So whether we're a freestanding rural health center or we're a provider-based rural health center, they will be cost-based. And so as I said earlier, how you manage cost within a critical access is just as important to manage the cost and how you drive costs to a critical access department of the hospital. So we are putting processes in place now to make sure we're sending all of our direct costs to those cost centers, which today we are not. But by the time July 1 gets here, we will.
Any further questions?
Yes. Where does the Baird Clinic stand? Because I live in Baird and I haven't seen any activity there.
I'll answer that for you. And Rennie has been working on this. We had a community member in Baird come to us with an alternative site. And so we're looking at that. We have an architect that came down this week, and he's looking at that space so we can proceed. Also, the city of Baird has approached us regarding some property that they have that they would like for us to look at, and so we will be meeting with them just in case we need an alternative site. So as we get closer and closer and we get a report from the architect on this one location, I'll bring that back to the commissioners.
So the current clinic isn't viable?
No, it is not. It is not. It was going to cost almost $350,000 to get it to where it needed to be. So actually, this was a blessing in disguise that we started to renovate it, and somebody said, that we shouldn't be doing that without certain permits, and so that's where we are right now. But it would have been a danger of the past renters, and it's a good thing that we found out.
Okay. Well, and I have another question. It comes completely out of left field. And I think I read this in the paper or the media or something about the board considering going away from being a county-owned hospital to a 503C. And now, is that possible, and what would that mean?
There was one member that brought that up in open discussion last board meeting, and it was just when you come to our meetings, you'll see that there is a time where each one of the board trustee members has a commentary that they want to share. And there's really no discussion with it, it's just a comment. And so one of the board of trustees just mentioned that. Now, what it would take, I'm not quite sure what it would take. We haven't looked at that and hadn't had need to, but I can report back to you next time because we are going to investigate it, just so everybody knows what that would take. But it would have to take approval of the community, I'm sure.
But is that a possibility?
Yes, it is.
Okay, thank you.
I just want to add one more thing. I forgot to let you know this, that we have hired a new chief nursing officer. Her name is Rose Lopez, and she will be starting the 20th of this month. Her husband is also a nurse, and he's coming down for an interview this week to see what position we have that he would be interested in. Okay. Any other questions?
That's it.
That's it. Thank you.
Thanks.
One other thing, I am so sorry I forgot this. We have an issue that we're working with Charlene with regarding some payments that we submitted, which I guess were late payments. And as you know, we have always told you that we're working on getting these bills out more timely, but there were several bills that missed, I guess, what our some contract or agreement that we have regarding the prisoners and services rendered to them. And because we missed this threshold, the claims were denied. So we're going to appeal this because they are services rendered, and knowing that the county is a partner with us, we would sure appreciate some latitude on this because it was the amount of a little over $70,000. And this means a lot to our community to get paid, for our hospital to get paid. So I know Richard is going to be working with Charlene on this, on an appeal, to see if we can recuperate that money.
And definitely, I mean, you have your processes as far as appeals, but we do have, certain policies. Mm-hmm. And being billed for inmates that weren't housed, that didn't go up, that weren't, or getting bills of people that weren't inmates at the Grant County Detention Center. I mean, you have to understand where this board comes
Absolutely,
from.
Absolutely. And if that is the case, with $73,000, I would certainly want to look at that and how we're collecting that information, because that's not quite, I can see it happening once, maybe twice, but $73,000 or more, I'm completely baffled by, but we're going to be looking into it before we appeal that.
And I don't believe this has been the first time this has happened, but I think the Board of Commissioners have really looked at it, and the decision was made by the Board of Commissioners not to pay these bills. It was just our direction to our county manager. So just so you understand, that's what direction we took. But like anything, you do have an appeal process, and I'm sure when it comes to us, we will take that into consideration.
Thank you so much.
Thank you.
Any other questions?
No, thank you.
Thank you so much. Thank you.
Thanks very much.
Okay, still under presentation reports, Hidalgo Medical Services update, Mr. Ordero.
Good morning, Mr. Chairman, and Commissioners and County Manager and County staff. Good morning, and thank you once again for giving me the opportunity to share some updates regarding Hidalgo Medical Services. At the pleasure of the Commission, I did invite Dr. Nelson and Dr. Bowen to provide some more, not necessarily longer, but let's just say more comprehensive updates regarding what's going on the medical side as well as behavioral health. But prior to doing that, I'd like to just clarify one thing. I have some high-level updates I want to provide, and then I want to do a clarification regarding our FQHC status as well. I may have shared this with you all before. HMS has been in this community since 1995, started in Hidalgo County, and started off, obviously, once it received its FQHC status, there was one individual and then an administrative assistant, and now we're up to almost 250 employees. And the reason I bring that up is because we've been working really hard to serve both communities in any way that's possible and viable from a business model standpoint. As a matter of fact, one of the requirements of the federally qualified health center is to do a needs assessment every other year to find out where the gaps in services are in the community, and then it's our responsibility to do business performance to determine if we can fill that void. So we take a lot of pride in doing that, and I think that's what led to our growth as an organization, is to dive into that, find out what our community really needs to be a viable community, not only from the healthcare side of the equation, but also from just a general economics and general quality of life that in our communities. One of the strategies that we've employed about 3 years ago to do that better is our pursuit of the Malcolm Baldrige Award, and I'm sure most of you have heard of that. The Malcolm Baldrige Award is a national quality award that basically guides us through a comprehensive process to look at our systems and our processes and our care delivery models in order to fulfill the needs of our customers. And I bring that up because the state of New Mexico has that initial methodology that we use to get us to the national level. And there's 4 levels at the state to get us to the national level. At the state, it's the Adobe, Pinon, Roadrunner, and ZIA. And when an organization fulfills the ZIA level recognition, that's when we would apply for the National Malcolm Baldrige Award, which is a presidential award. And I'm bringing that up to share just quickly with you that we have received the Adobe and the Pinon Award, and we are now going to be submitting our Roadrunner Award here in the next couple of weeks. So hopefully we'll also get recognized for that so we can begin working our next phase of excellence. And when I talk about excellence, there's 2 metrics that I continue to share with you that we're quite proud of. There's 15 measures, UDS measures that HRSA, the governing agency for our organization, requires us to report. And all 1,500 approximate FQHCs around the country report those same measures, both at the state level as well as at the federal level. And HMS is continually getting better and better on better quality outcomes. And we're exceeding the state at 10 of 14 measures here in New Mexico as compared to the other 16 FQHCs, and 10 of 14 at the national level. And when I said 10 of 14 at the state level, they just changed one of our measures, and so that 10 is now going to shift back down to a 9 because it's a brand new measure. They rewrote the operational definitions of that. But the key point again is we've made great progress in our quality scores, which means that our patients are receiving better clinical care overall. The other key metric that I'd like to share with you is our patient satisfaction. We measure the satisfaction of those that come to us for services in all of our service lines to make sure that we're meeting what we call the experience of care. Are you getting high quality, and are you satisfied with the way you're treated, the courtesy, the timeliness of your visit, information provided by the doctors and therapists and clinicians. And we are at 93% satisfied continuously. Now we're continuing to work. The higher the better, obviously, but in healthcare, that's really good. That's a really good satisfaction score. The other thing when I'm talking about community and community support, and since Dr. Nelson's going to step up and give a brief update as well as Dr. Bowen, I want to talk about kind of that unforeseen, the services that happen in the background. And you've all heard of them because we talk about our services now as medical, dental, behavioral health, family support, senior services, and now care coordination, and of course our residency program. But family support, I just want to provide a little bit of data because I think it's really powerful. HRSA requires us to provide what's called enabling services. And we've expanded that definition to be much more than traditional enabling services, which address social determinants of health. We go above and beyond. So, for example, like I mentioned, we do provide a sliding fee for patients that don't have insurance, they're uninsured or they're underinsured. And year to date, we've enrolled 1,900 individuals onto our sliding fee so they can receive services. Year to date, we've enrolled 425 community members on our Medicaid or New Mexico Health Insurance Exchange. So again, as an enrollment center, we're making sure people that don't have insurance have a way to get enrolled and get that insurance so they can get the care that they need. We've had 191 community members that didn't have access to food. I'm pausing on that, right? Not a big number, but just picture those people in our community, and you think about Maslow's hierarchy of needs, and we need to get them in for mental health services or medical services, and they don't even have a meal. Healthcare is not at the top of their list. So again, this is an example where we're trying to fill those voids. We've had 193 individuals who have come in to get their utilities, get support to pay their utilities. I remember going way back in the day when Commissioner Ponce and I were on the streets. He was working as an officer and I was working as a paramedic, and we would go to people's homes and they have no heat, and these are elderly individuals. And they're extremely sick or they're hypothermic and they have to be taken to the ER. So these are basic needs that we're trying to help fulfill in our community, and I just really wanted to stress that. We also helped 135 individuals complete their application for Social Security disability, for example. So family support does a whole lot more than get people enrolled in insurance, get them access. We're trying to meet those daily social determinants of health needs as well. And then just quickly, I want to give you an updated stats on our senior center program. We're having increases in participation from our seniors. Right now, year to date, we've had 24,860 congregate meals provided to our seniors, 49,200 home delivered meals, 7,300 transportation trips. And again, remember, these are transportation to get them to those basic needs like healthcare services. And throughout this year to date, we have about 800 seniors taking advantage of our senior center program, which again is a partnership with the county. And it's going very well. And quick statistic on seniors, because we're getting ready to have our, I've talked about, we've received the Freeport grant to do a study on senior services and needs in the seniors in our community here in Grant County. The state of New Mexico is moving from being 39th in proportion of older adults, 39th in 2010, to being 4th in 2030. So we have our next advisory committee meeting tonight, and we're starting to see some of the preliminary data that's coming out regarding this extreme challenge that we're all going to be facing in our communities and the economic impacts to that as well. So there's going to be a lot more to come on that. And then I promised that I was going to clarify the comment that HMS is an FQHC and is run by federal funds. It is true, but we're supplemented with federal funds to serve the uninsured and the underinsured. In early 2016, we were a $19.5 million organization with about $3.5 million being federal funds. That's a combination for serving the uninsured and underinsured, as well as our Teaching Health Center grant. But today, we're a $25 million organization. And that growth has been a combination of service expansion and general revenue based on patient care delivered through our traditional payer sources, just like any other healthcare system, in addition to some additional grant funds that we receive, for example, with our care coordination programs. So yes, we do receive federal funds. And as a matter of fact, the more patients that come to HMS, to our primary care clinics, to our behavioral health clinics, to our dental clinics, it actually changes the calculation factor at the federal level of how much money comes back into our communities. So we're just going to continue to work hard to provide the highest level of quality and service to fulfill the needs of our community and fulfill the requirements of the federal FQHC status. So I'm going to hang back for questions if you have them, but I do want to ask Dr. Nelson to come up now and provide just a brief update on medical and the residency program, please.
Good morning, Mr. Chair and Commissioners. Thank you for having me. Thank you, Dan, for that introduction. I'm going to talk about three things. I'll keep it short. The residency program. We do have a family medicine residency program here in our great town and county. We will graduate 2 new family medicine board-certified residents in less than 2 weeks. Couldn't do this without the support from our community of physicians, without the support from GRMC, and without, of course, the support from our patients who are willing to come and see our residents and help them learn and make them into great family medicine physicians. On a positive note, one of these graduates we are retaining here at HMS, and he's committed to serving the senior population. So Dr. Amendetis will be seeing him around a lot more. Secondly, we had a visit from U.S. Representative Torres Small on Saturday. She came specifically because she's co-sponsoring a bill that would help extend this Teaching Health Center federal funding that we get to train these residents. What that means is the federal funding for the residency program is about $900,000 a year to train residents in our community. That usually is reauthorized on a 2-year cycle. The new bill that Representative Torres Small is sponsoring takes it out to a 5-year cycle and also has extra money for expansion. Wouldn't it be great if we had 4 graduates instead of 2 each year? It has money for a cost of inflation. It was a very great visit. I could tell that Representative Torres Small was incredibly genuine and took great interest in her district being the host of New Mexico's only teaching health center, not only in the state, but also the only residency program that's not located on the I-25 corridor. It's a pretty cool feather in our cap, I think. And finally, I'm going to talk a little bit about something called medication-assisted treatment. That's a treatment plan that we use to treat patients that have opioid use disorder. It could be heroin addiction, it could be opiate pill addiction, things like that. Back in August 2018, there was one physician in all of Grant County that had a special DEA waiver that allowed them to take care of opioid use disorder patients. Unfortunately, that physician left. HMS stepped up to the table in September of 2018, having one physician take over a lot of the patients that were in the program. We've now grown in 10 short months from one physician with a special DEA waiver to 5 in our community that can now help patients recover from opioid use disorder. We've got 2 more in the pipeline too. So the end of my story is HMS is adding capacity to help our communities deal with this opioid epidemic. Our doors are open. We say no to no one, and we will do our very best to help our communities recover and be healthier. Thank you. I'll be happy to answer any questions.
Thank you. Thanks. Any question?
Okay. Dr. Bowen, you mind please share an update on the behavioral health side, please?
Good morning, Mr. Chairman and members of the Commission. Thank you very much for the opportunity to give a real brief update. Excuse me. I'm going to also speak about just 3 things quickly. The first is I just want to acknowledge that HMS has stepped up and become a major behavioral health provider in our communities as a result of the Medicaid debacle which occurred in the state in 2013 and then led to the Arizona companies coming in and then leaving our service area. And I mention that in part just to point out that on June 13th, which I think is Thursday of this week, KRWG is going to show a documentary on what happened in New Mexico to the Medicaid behavioral health system called The Shake-Up. And it'll be on KRWG, I think at 8 p.m. It's a 1-hour documentary and very much worth understanding what's happened to our behavioral health system. And I want to underline how much we've done as a state, and HMS has contributed significantly to this, to build not just rebuild the existing system before that happened in 2013, but a much better system. We're really aiming at providing an excellent behavioral health system to our communities and our neighbors here in our part of the state as well as statewide. And that's part of why HMS has been so committed to working at the state level, because I think this is a system which only works if it works for everybody. You can't have a center of excellence that's outside the rest of the system. So we've been honored to participate in that. And as part of that, we've also become aware of a coming national trend moving away from the reimbursement system for behavioral health of fee-for-service, just you see people, the more you see them, the more you get paid, to value-based purchasing. In New Mexico, that's more present on the medical side. It's growing on the behavioral health side, and we've been a leader in helping the state behavioral health system get ready to be successful in value-based purchasing. And I bring that up in part to lead to the main topic I wanted to bring to your attention today, which is Tu Casa. Value-based purchasing requires providers of services to be able to demonstrate the quality of what they do. So providing evidence-based therapies, showing the positive outcomes for the people we serve, but also be able to manage costs effectively and to keep costs well under control. So many states now have behavioral health provider associations which provide scorecards for individual providers in their state that show on one graph their costs for providing services and the quality measures that come up. And as Dan mentioned before, HMS, we're at the beginning phases on the behavioral health side of having those kinds of dashboards of quality indicators. We're doing very well on the medical side. We're also in a good position to be able to show the quality of what we're doing on the behavioral health side. And medication-assisted therapy is one of those, as well as making sure that the prescribing practices of the nurse practitioners and psychiatrists and prescribing psychologists, and we use 2 of those 3 groups, are actually meeting the needs of the families and the individuals that we serve without putting them at undue risk. The psychotropic medications we use on the behavioral health side are among the most dangerous medications out there. And so we're very serious about monitoring the quality of the prescribing practices, and that's led to some changes in our prescribing staff because of monitoring that quality. As far as TUCASA, I know that you've probably seen it in the paper that we did finally receive our Crisis Triage Center licensure. We were the first in the state of New Mexico to receive that licensure. Bernalillo County now has the second. And that's opened the way for us. We're in a very active recruitment and hiring process to get to the 21 staff that we need to be able to open 24/7, which was the design of the facility from the get-go. So I'm glad we'll be able to get there. And you know, there's something called the planning fallacy in business, which everything takes twice as long as you think it is going to take, and we've already exceeded that for TUCASA. So I hesitate to say when we'll go 24/7, but we're well along the path to get there. And I also wanted to point out that the county commission here in Grant County very generously, when we applied to provide the services at TUCASA, we indicated, we understand this is a Grant County project, but we are Hidalgo Medical Services, so we'll provide services to residents of Hidalgo County. And the county commission responded saying, of course you will, and you should also be open to Luna County and Catron County, or historic catchment area for behavioral health services. And on that note, the Luna County CYFD and another agency in Luna County have approached TUCASA about providing transportation from Luna County to TUCASA to obtain these specialized services, including medication-assisted therapy, which will start up there next Monday, and the other specialized services. So those were the highlights I wanted to give you today, and of course I'm open for any questions as well. Thank you very much.
Thank you. Any questions?
So I don't really have a question. I just want to acknowledge how truly fortunate we are to have Dr. Bowen in this community and his commitment to behavioral health. Thank you so much.
Thank you. Mr. Chair, for Dr. Bowen, could you explain value-based purchasing, which is what I thought I did for my family every week, especially in the case of behavioral health. I picture something like an HMO, but I don't know how that works for behavioral health.
There's actually a continuum of value-based purchasing models, and wisely the state of New Mexico has chosen with behavioral health to start at the early end of the continuum. And basically what it says is if you can demonstrate meeting certain quality measures, for example, and this is one we already exceed as HMS, making sure that people who are discharged from hospitals, psychiatric hospitals, or from an emergency department are seen in outpatient treatment within 7 days. Our goal is 3 days. And we're doing very well now that we have good access to data about who's being released from the hospitals. And the reason for that particular measure, for example, is most people don't understand that one of the most dangerous periods for someone who is imminently suicidal is immediately after being released from the hospital, either the emergency department or psychiatric hospitalization. So if you can demonstrate meeting that goal, the MCOs will share some savings, so you get shared benefit because of that quality measure, not the number of times you see them, but because of the quality of what you delivered. And then as you move up the continuum, you move to where you're sharing risk as well as benefit with the MCO. So what value-based purchasing is really designed to do is reduce the overall healthcare costs for the overall system, while improving the quality and improving the patient care and the experience of the providers as well. It's the quadruple aim. And then it goes all the way up to where you get bundled rates for certain things, and that will happen at TUCASA for that assisted withdrawal process that we'll do at TUCASA. We are working right now with the state at identifying a model for a bundled rate for that, so that instead, rather than billing Medicaid every time the nurse goes and hydrates the person or takes their vitals, we get one rate for the full time that they're in one of our chairs there. And then that can go all the way up to capitation, where you get a certain rate for managing the population. And so as you move up that continuum, you get more risk, but you also get the potential for more benefit.
And if we get to the point where you're using capitation are we going to be counting the population of neighboring counties because they're part of our catchment area?
That would certainly be part of the complicated calculus.
Yeah.
That's correct. Yeah.
All right. Thank you.
Thank you.
Any other questions?
I actually had another one for Dan, if I might.
Yes, go ahead.
You very much raised my curiosity with the demographic information you provided. That we're going to move from 39th to 4th in the span of 20 years in terms of, I assume, proportion of our state residents who are elderly. And I know this is happening across the country, but I did not realize it was happening disproportionately here. And I guess I'm curious, is that strictly due to influx of retirees?
It's a combination of influx retirees and of course, the baby boomers in that whole transition of people. I know. Yeah, so there's a combination of things, and we're going to be providing in August, actually it'll be early September, we're going to be providing the County Commission a report from this research study that we're doing, and it'll really start getting into the details of that. But yes, that's the projections moving forward, those numbers that I shared.
So I know our teen pregnancy rate has dropped a lot.
Yeah.
And I guess I was curious if that was a piece of it too. That statistic's really quite remarkable.
Yeah, and it's creating a lot of challenges for communities just to be able to keep up the services to support the seniors and keep them healthy as well along the way. And so it's pretty interesting as we're starting to look at the data early on.
And as far as you can tell, as the state goes, so is going Grant County?
Yes, yeah, including Grant County for sure. And if I may, just to follow your previous question, Dr. Bowen did a great job of explaining value-based reimbursement. I talked last time I was here 2 months ago about the fact that HMS is one of 6 FQHCs in New Mexico that established New Mexico Care Partners, which is a limited liability corporation, so that we could, underneath that umbrella, start a clinically integrated network. And it's exactly what Dr. Bowen's talking about. And this early phase of clinical integration and value-based reimbursement model is just for the Medicaid population. So it took our 650 Medicaid recipients that come to CHMS to 100,000 across the state approximately, that we will work with the payers to, again, do exactly what Dr. Bowen said, improve quality of care and reduce the cost of care overall. So again, we're taking a lead on that because there's a lot of good. The other piece of that equation is it's mandated in Centennial Care. Value-based reimbursement models is a mandate for us. So we have to be in this process by 2020, which we're ahead of the curve, and then the risk structure going from downside risk to upside risk is going to shift. So it's going to get to the point where if you're not hitting those quality metrics, we'll get penalized, have to give money back to the MCOs. So it's an interesting time in healthcare to keep up with that. So if there's no other questions, Mr. Chairman?
I have a clarifying question about the demographics also. So that's 12 years away.
Correct.
That is not very much time. So I'm curious to know how much of that demographic shift also has to do with the law. So you're talking about it proportional. So how much of that has to do with the loss of young people, people leaving the state? Do we know?
We don't know yet. That level of detail will definitely be in the report. It's going to be a comprehensive.
I know last year, for example, the state of New Mexico lost, 44,000 people in population.
Right.
So, how much of this is driven by that loss of population?
Yeah, I can see where the distribution would absolutely shift with that factor as well.
Right.
Yeah.
So the other question I have is, there's two really distinct populations of seniors in Grant County. The folks that have and the folks that don't. One of the things that we do quite a bit in Grant County, in my experience, is rely on the seniors who have to help with the seniors who don't. Volunteers, donors to programs, those kinds of things. And I think there's a lack of awareness, a general lack of awareness of how much stress there is in this community on seniors for very basic needs, like enough to eat and those sort of things. Do we have any idea how much And we looked at how much this population shift is going to impact that. Is the low-income senior population going to rise and the upper-income senior population going to go down? Do we have any idea about that? Because it's not just services for seniors, but it's basic needs being met that are really going to put pressure on the system.
Absolutely. To answer the question directly, no, I don't know the answer to that quite yet. The process has been very comprehensive. Everything from one-on-one interviews, 2 separate surveys are going out, not just to the seniors, they're going out to all of us, all the constituents in the community, as well as family members that are taking care of these individuals, business leaders, etc. We have a very large advisory committee, I think it's up to 20 people that are contributing to the conversation and the dialogue regarding the barriers and the challenges now and moving into the future based on the national data, the state data, and our local data. I actually met with a researcher yesterday in a meeting, and we were talking about all those variables. And we're already starting to talk about what recommendations are we going to make coming out of this for all the municipalities and the entire county to say, how do we respond to this? Because it's going to take all of us to address a really serious need. I mean, the corollary I like to think of is what's going on with addiction right now in our state, in our community. We've had to put a lot of intentional resources towards that to address it and even make a significant dent on that. So I think that it's going to look very similar with the senior population, and it has some long-term negative implications if we don't get it right. So I'm glad we're taking a lead on it together, as all of us as a community, to try to move in that direction to address it.
Thanks.
I have one question.
Yes, sir.
Being in this right now, I've been totally surprised at how many seniors are being taken care of by their family members. And this goes from to take them to the doctors, specialty care, dialysis. They can't be alone because there's really nothing available in the community that they can qualify for. So is there anything in the works to be able to provide services to seniors that need a higher level of care?
Yeah, some of the services are available, right? We have a local nursing home. We do have dialysis locally. But the example of how fragile it is, I don't know if you all heard, the nursing home has been around forever. I'm just going to say forever because I don't know how many years, in Hidalgo County is closing. And so you think about that small community and how fragile it is economically, and now we think about the seniors and the population there. This is just going to shift things for them in a significant way. So I don't think I've answered your question directly, but yes, there are services, just not adequate services. Skilled nursing facilities are difficult to come by, and a lot of these seniors are having to go out of town to get those services. And now the family that's taking care of them to transport them to their local services, now they got to try to get them to Las Cruces or Tucson or another area where they need to go. So, but I think that's what we're trying to bring to light through this study is where are the gaps, and how do we work together to try to close those gaps? Because I remember meeting with Dr. Ski about 4 years ago, and he was sharing with me how many of his patients, seniors patients, were moving out of the community just because they couldn't access services.
Well, I think that what that does is it leaves people behind that can't afford to leave the community. And so what you have is a disproportional increase in people who need services who don't have access to them. And I want to also point out that in addition to the seniors that are being taken care of their families, we have in Grant County have a significant population of seniors who have no one to take care of them. I think that is also something that we have to really be thinking about.
Absolutely.
There are, the statistics on things like unattended deaths and that sort of thing all really shine a light on how many people in this community don't have access to services.
Very true. Concerning.
Any further questions? I just want to thank you and commend you guys for looking at certain things and for the services that you do provide for our surrounding counties and communities, and recognizing that there still are gaps here and putting out surveys and working on that. I think that's very commendable, and understanding what our rural communities are faced with, and I'm glad that you guys are looking into that. I really appreciate that. Thank you.
Thank you, Chairman. Thank you, Commissioner, for the opportunity, and we'll see you again in August, I believe, unless we need to come sooner, but we really appreciate it. Thank you.
Thank you. Thank you all.
Okay, moving on to the next item on the agenda, review of June 13, 2019 regular meeting agenda.
Mr. Chairman, Commissioners, first item, presentation to Sergeant Manny Maldonado for his life-saving efforts for the woman in Las Cruces. The Sheriff and Manny will both be in town on Thursday, right? So we'll be able to make that presentation.
We'll get the spelling right on the presentation.
I think we corrected that, yes. She's not looking up, but I think we corrected the spelling error.
Appreciate it.
Moving on to new business, item D, Grant County Trail priority interest expressed by selected community business leaders and user groups. Marcy DeMillion with the National Park Service will be here to present to you the findings of her survey. Misha talked briefly about this in his report. Is there anything you want to add to that? Any questions on that? Item E, Baton Park Pavilion project quote. So we received 2 quotes back from Classic Industries, who is a design build firm. They were emailed to you. They're also in Novus. So you have 2 options in front of you. The first option we'll talk about is a grand total of $59,522.13. This is to make the interior of the building ADA compliant. There's issues with the restroom. Also, replacing the cooling as well as the heating, creating the ADA parking and all related access to the building. This quote, remember we continue to talk about drive-in versus walk-in. This is to be able to use the existing lane and drive up to the pavilion. The second quote in the amount of $116,240.52 is the walk-in version, which would require changing that ramp that we use as a drive-in to being able to make it ADA compliant for someone to access from the main parking lot to the pavilion. So Linda and I have looked at the current budget. We do have funds available to do, I'm going to call it option 1, which is the drive-in option of $59,000 and some change. We do not currently have money in the budget to do the drive-in or the walk-in version. This would basically correct all the issues that we have with the pavilion currently: heating, air conditioning, ADA compliant restrooms, as well as ADA accessibility to the building.
We don't have an item on the agenda other than in new business on that. So will you be looking to a future meeting for us to direct you to issue an RFP one way or the other?
We don't have to issue an RFP because this is design build. We can go directly with this. This was to save some time, so you could take action to accept this quote on Thursday or disapprove it. And we can move on to another option, but that's the reason I chose to go that route, is so it'd be a little quicker.
Thank you.
Thank you.
So the second one is from Classic?
They're both from Classic. So you have a walk-in version versus a drive-in version.
Okay. And my question is, so we're going after the CDBG grant, right? Would this pose any impairment to the grant?
No, actually it would not pose any impairment. Actually it would probably be an advantage, because I could show this as additional leverage as far as money spent on the same type project, but it would not, no sir, it would not impair it.
Probably give us more of a point system, right? More as far as points with that, right?
It could, because, so you have the match, the cash match, which you can use architectural engineers, any site testing, but then also part of the application is you have some additional leveraging. So any money that you spend above and beyond your 10% match is additional leveraging. So it shows that your benefit factor is better. The more money you can match it with, the higher points you score.
Can you tell me what Gordian fees are?
Gordian fees are through CES, and no, I can't tell you much more than that, other than it's a pricing structure that they use specifically for design build, and anything you do through CES is based on a Gordian fee structure. So it's just a way of it's a fee structure for contractors that they use. And that's the best I can explain it.
A related question would be, is it possible that the quote gets more expensive as a result of going through that Gordian fee structure?
It is possible. He did add that on there, so hopefully it won't exceed this, because he did. If you look at the quote, you'll see that the Gordian fees are included in that. I think I saw that somewhere.
Yeah, the part I remember is him saying this might change.
And it could, it could change like any project we do. Even if we bid it out, it could change once we get in there. But I would hope that this is a solid figure. I have no guarantee though.
Yeah.
So we talk about, this is a discussion, just discussion. We talk about going local a lot. So I realize why you went with build design, because that would save some time. In your experience, could we save some money and stay local, or has design build been competitive with local contractors, or would you have difficulty getting bids from local contractors?
It depends on the project. Some design, and this is just in my experience, not necessarily here. And in one project here, design build turned out to not be a good option because it was higher. I think this cost based on other small projects similar to this, it seems in line with what we would get from a local bidder. Some of our, what we get 2 to 3 tops when we've done small projects. Usually it's whole rate that gets typically anything small. Whole rate construction is the only one that's bids, well, he's typically the low bidder. I wouldn't know that until you put it out to bid, which we would be looking at. By the time we wrote the scope of work, put the bid out, went through the entire process, 45 days.
Okay, gives me an idea. Thank you.
Chairman, Commissioner Billings, I just want to point out that he is utilizing local subcontractors.
Oh, okay.
Okay, that was one of the things. Is he may be the general, but it is more cost competitive if he can utilize subs, local subs. So just want that.
Excuse me, that cooler is, there's only one cooler there?
Currently, yes.
Excuse me. Okay.
So I have a couple of clarifying questions. What's the propane for?
The propane is for the new heaters. That was the most cost-effective route to go when they looked at propane versus gas, which would have to be run from the highway, correct?
Correct. And currently the electrical service is not large enough to support 2 electric heaters, and the cost to replace the electrical service was a lot compared to just bringing in 2 heaters and putting in a propane tank.
But I don't see heaters on this bid.
2 each liquid propane units in Bay Area.
Oh, units. Okay,
units.
okay, got it.
The actual propane tank is not on here, but that's something we can absorb in our budget. That's not.
Gotcha. Okay, so I want the record to show that I am opposed to paying for cooling and heating in a building that has 6 bay doors in it that are not insulated. And I would like to propose that we don't do the heating and cooling in that building at this time. That the real issue there is the ADA compliance stuff, and that we look at the heating and cooling when we look at the CDBG project with the possibility that we may change those bay doors. I just don't think that it's appropriate to spend $14,000 on heating and cooling a building that has 6 giant bay doors in it. Just saying.
Be something to consider when Thursday.
Yep.
Food for thought, but
I'm guessing you considered this, but what's the, I'm getting in the weeds here a little bit. What's the problem with the cooler that's there? Just age?
It's one swamp cooler, and it just goes back to the number of complaints we get about they paid to rent the building and it's hot, or in the winter it's cold.
So we're replacing it with another swamp cooler that's...
It's not a swamp cooler.
Well, a master cooler is based on water.
Yeah, we're replacing one swamp cooler
I guess
with
it
another
was a swamp cooler. I thought we were looking at something other.
What's wrong with the old swamp cooler then?
Chairman, Commissioner Billings, it is just the age of the swamp cooler. It is just one of the older, non-efficient swamp coolers. And so in the process, we asked Rick from Classic to look at upgrading that to a newer master pool that is higher efficiency if we're going to stick with the swamp. Because again, trying to put in an air-conditioned refrigerator there is another electrical requirement. So.
I understand Commissioner Edwards' comment about the heat. A swamp cooler actually works better when there's some ventilation. Usually you use a swamp cooler, you open some windows anyhow to let the...
Well, I understand that, but there's a big difference in opening some windows and opening 6 bay doors. And unless we have a way to control the use of it, so in other words, if people have all 6 bay doors open, if there's a way to control the swamp cooler being off during that time, then that's a different story. But if it's on because it's rented, and then people can open and close those doors at will, then we are heating and cooling the outside with taxpayer money, and I have a serious issue with that. I understand that that heating and cooling is part of renting the building, but there are other options also for people to rent in the community. And so I think we need to stick to our original thing, which was to make sure that people had ADA access to that pavilion, and look at the rest of the upgrades that we want to do as a package.
And going along with Commissioner Edwards there, the cooling is not as much of an issue as the heating. In the wintertime when we rent that and it's used, there's no way to provide heat. So, that's something to consider. And also, one of my questions was if things can be adjusted, just like I see a need for a larger cement slab. So if we did away with, say, the swamp cooler, can we extend the cement slab to be across the front of the building so that we could provide access, both an entrance and a separate access or exit. So, I think there's some considerations that we could do there and we could discuss.
I'm looking at, to me, this is a start. Eventually, it's going to have to be replaced anyway. And I understand Commissioner Edwards' concern, but whether it comes out of CDBG, I think this, to me, what I'm looking at is it's a start to accomplish one of our goals. The complaints that we do get, and I'm not sure if the other community said it is, we're renting it, it's cold, it's hot, it's this, it's that. If we're going to continue to rent it, I think that this is a step towards what we need to accomplish there. And yes, I totally understand the bay doors. I'm not sure what, the ADA or what fire code or how many doors need to be open as far as being able to lock maybe a couple of the bay doors and leaving one accessible for them to open. I mean, we could look at different options, but for me, I think this is at least a start to where we need to go, where we need to head. And being that there is money there, I think we should, my opinion would be we should jump on it.
Mr. Villa, would fire code allow for all the bay doors to be locked?
No.
How about all but
So, I mean, I
Would all but one?
I can't give you a definite answer on that. I'd have to talk to the...
That sounded pretty definite to me, no.
I mean, the problem is you got to have that exit, and it depends on the amount of people within the room and how many exits are at. If you look at this room, look how many exits are and how many it holds. So that's the purpose, but, you know, to actually recite the code, I have to look at it.
Would it be possible to find out between now and Thursday what the requirements would be on, like, all but one bay door being locked, or, you know, could we find that out between now and Thursday?
Mr. Chairman, Commissioner, yes.
I really appreciate that.
That was pretty definitive also.
Yes.
I'd just like to add that with my recent experience with Baton Park, I'd hate for the commission to get into micromanaging what people are going to do out there, because I understand your concerns, but we actually cooled the building by opening several of the bay doors, just bringing them up about a foot, created a nice breeze through there. The front three were already open, and then it got a little bit windy, and we shut the bay doors. There's some control there with those bay doors. I hate for the commission to get really technical. I think people are going to, if it's cold, they're going to do what's wise to keep it warm, which is not opening the bay doors. If it's hot, they're going to do what's wise to keep it cool, if within their ability to reason and know what that is.
Well, I think the bay doors, so I totally understand what you're saying about that. I'm not necessarily talking about them being wide open, but I am talking about the fact that, you know, when you insulate your house, you seal your windows and doors, and those doors are not sealed. And we're talking about footing the bill for propane and electricity to run heating and cooling enough for people to be comfortable in a building that was not made for that.
That's a good
question.
question.
I have some serious concerns about what it's going to cost the county, not just putting these in, but what it's going to cost the county in the future to run them.
Are we currently heating the building?
A small heater.
So you should have, with one heater, so you should have some idea what it costs now. Is it? Do you go in the hole every time you rent it in the winter, or do you know? Okay. Mr. Villa?
Mr. Chairman, the heater that's in there now, with the capacity that it has, will not, it's not efficient for the winter time. Just put it that way. And when you look at the amount of people in there, because you get the bay doors open, you could have a whole bunch of people with the bay doors open that don't require a certain amount of occupancy with the doors shut. And then, of course, you're not going to please, 50% of the people want it hot and other people want it cold. But to answer your question, Commissioner Billings, is that the heating system in there now is not efficient for the winter.
And will the new heating system be?
Well, I'm sure it will be. There's no sense in us going that route if we're not going to do it to be efficient. So I mean, I'm not trying to be sarcastic. I mean, yes, it would meet the requirements of the size of the facility.
So it would warm the building up and then a little bit of the outdoors too.
Well, I do know that I talked to Horace Jaramillo, and he was in charge of putting that building up. And the reason for the bay doors was so that you could avoid occupancy problems, issues. So once you open the bay doors, it no longer becomes an enclosed structure. So you don't have to follow occupancy.
That's true.
As far as the heating and cooling, if you look at the electrical there is at the voltage is 480, and they step it down to the industrial 277. But there are other heaters that will take that voltage, because what we're proposing is to go propane.
we're dragging on, and I don't like to do this, but the building, the exhibit building now at Cliff has no heat, is that right?
That's correct, but because it's becoming a polling place, we will have to install heat.
Okay.
State going to provide the funding to do that?
No.
Are we talking about that giant building where we do food distribution?
Yeah, and there's 100 people in there doing that food distribution, and they're pretty well freezing in the winter.
Right.
It's cold in there. I don't get cold easily. How much will that cost? Okay,
Jason
never
gave me a
mind.
quote, I don't
Right,
recall.
okay. All right,
I
thanks.
couldn't give you the number off the top of my head.
Sorry, I'm done.
Well, I'm done too.
Any further discussion?
No, but if I have to choose, I'll go 88.
Yeah, I think it's a good start.
Yes, it is.
Move on to agreements. Item F, consideration of agreement A1918, master purchase license and services agreement with Colossus doing business as jail tracker for jail management system services at the Grant County Detention Center. This was tabled from the last meeting, and I believe that has Abby's review and everyone's agreements to the report. Anything you wanted to add to it?
No. This is sort of the other piece to the in-cartel agreement that you saw at our last meeting. This is all the software and the services related to the software. I don't know if Mike has any more to add. I mean, I don't know actually the details of how all these things work, but it's basically all the software and services related to how they track everything at the jail. So this is the other piece to it.
As I recall, is replacing the system that is obsolete or...
I don't know if it's obsolete. I know that Mike was ready to move forward with this new stuff. I don't know if Mike, you want to say anything about that? She was thinking that the previous software was obsolete, but I don't know if it was obsolete.
Explain why you wanted to move from XGELs to this. XGEL is not obsolete, but you had reasons for looking at this.
Mr. Chairman, Commission members, the purpose of providing you with consideration for this agreement is our previous contractor, which is XJail, which is Securus. It was in that agreement and in that jail management system that when I first came here almost 6 years ago, we've had a consistent issue with the service that's being provided by Securus. We've had some issues with the programming itself, as far as the system going down, having any kind of technical assistance and individuals responding. We can't afford at the detention center because our jail management system is our booking system. When it goes down, we can't afford to have any kind of lapse in time, because then we have to go to a paper process in order for the entire booking jail management system. So I continuously had some issues with their technical support, which is in, I believe in Texas, either Houston or Dallas, I'm not sure which, I don't remember, or maybe both. But anyway, their response was not the best. When we asked them to fix the system, or we asked them to make adjustments in the particular jail management system that we needed to make, we either didn't get a response or they just didn't do it. So I started looking around, started asking some of the other facilities who manage their system. I was able to talk with the representatives from Jail Tracker. I have been meeting with them. They have been coming down. They have been putting on demonstrations. I have looked at the jail management system. The reason that I would like for you to consider the system is because it is an upgrade, it is an improvement, it is a better recording and tracking jail management system. And the other thing that I liked about it is there's more options that we can include. We can build the system to our needs. We don't have to accept a system that's already been built for us, because we know what we need at the jail. We know what issues that we're presented with in our jail management system. We've been looking at that, and I guess the one thing that I really like about the jail tracker system is the accountability to our employees and to the corrections officers when they're doing an actual booking. We can highlight areas or all the areas that we want in the entire booking process. And if at any time those drop downs, if you will, are not filled in properly, they cannot continue with the booking process. So it really eliminates a lot of mistakes or oversights in the booking process, which I think is really going to help us a lot. And I just think it's an entire improved system. They'll come in, they'll archive all of our records, all of our previous records. They'll archive all of those. So I just ask for your consideration because I do believe it'll be an improvement over the system that we have right now.
Thank you.
You're welcome, ma'am.
So I have another question, and Harry and I were just having a little side conversation about this, and neither one of us can think of exactly what this was. But at the affiliates meeting, we attended a workshop about detention centers and what was happening around the state. And there was some kind of integration that needed to happen between some state services and detention center software in order to access some of these state services. Will this do that?
I can't answer your question. I don't know if it will. I know that it's compatible with a lot of the services that are required by the state, but as far as if you're asking me if the system is going to be, if they're going to be a generalized system for all detention facilities?
That's not what
There's a program, the name of which we cannot remember, that the Department of Health is supposed to be pushing out to counties, and they have a mandate to talk to all of us, but they hadn't. At that time, they talked to like 7 counties, right, out of 33. But it's a program that, among other things, as I recall, helps transition folks out of detention and into services, but also, I believe, help pay for some costs when they're in detention. It sounded pure advantage and no disadvantage. And the only catch that I recall was the software systems had to be compatible. But I don't remember what it was called.
So I gave you, Mike, I gave you that woman's card.
You gave me what, ma'am?
I gave you the woman's card that we talked to about this program when I came back from that meeting.
We can do this outside of the public meeting, perhaps. But it would be important to me that if we're going to spend money changing our software, that what we're getting be compatible with whatever it is we need.
Mr. Chairman, I think that's something, you can make that phone call and you can ask them, and these other counties that you spoke with, you need to make that call between now and Thursday and have an answer for them as to whether or not they have the potential to bridge or interface with state programs, whether that's DOH, whether that's Department of Correction. It's a simple interface, simple bridge. I think that you can have that question answered by Thursday if you would do that, please.
I can do that for you.
That was a very good question, yeah, because we don't want to spend money today and spend money tomorrow if they do go to that system. So.
Yeah, on top of that is I didn't see a cost associated with this. And I went through the contract a couple times. Did I miss it, or is it already in the budget so it's not specified here? I don't know if there's a cost to this.
There is a cost.
That's different than what we were already paying.
Was it more or less? I don't remember your cost. This is $14.30 a month. That's roughly about the same as security.
It is about the same as
right. So the difference is minimal. Okay, thank you.
Mr. Chairman, I think I just wanted to throw in that the previous agreement is also expiring, so we will definitely need to probably move forward with this one as even if it wasn't compatible, and then maybe down the road, look at the termination of the contract, not terminating it, but the expiration of the contract, and try to align this issue with that, because we can't go without this service. Right. Does that make sense?
Yeah, that totally
now
makes sense.
we have a timeline that we have to get a new one in there.
I understand that. So is there any way we could find out when this contract's going to expire instead of if we have to jump Because to me, this decision doesn't have to be made right away. If we have to table it, if the contract's not expired, nor is the contract.
No, we need to make a decision. It is expired.
Why? Because it's going to expire when?
Not this one, but the current one that we are using is expiring.
That's what I mean.
In just a month and a half, I think.
Well, if you can get us an expiration date, because I mean
Certainly, I probably have it written down in my office.
There's three things that I think that I would like to have in order to make a decision on Thursday. The answer to the question that Charlene directed to Mike, the expiration of this, and a little blurb from you about how we'd get out of it if it wasn't compatible.
Well, and let me rephrase what I said. It's probably not compatible today, but many of these software companies, like even the financial software that we use, they are able to, and this is geek talk that is above my head, but all they do is they create an interface that ties to whatever specific state agency that you need to interface with. I just want to know is the capability of that interface with this there, but it's not necessarily going to be compatible today or next year.
That's semantics. We need to know on Thursday if this will work in the future. And so if a workaround is, if they can say that, then an interface, whatever, that works for me.
Any further discussion on this?
Thanks for looking into that.
Yeah,
thank you.
Appreciate it.
Are you ready? Sorry. Item G, consideration of agreement A1924 between the State of New Mexico Department of Finance and Administration regarding the DWI grant agreement program. Cindy, you're already there.
Good morning, Mr. Chair, Commissioners.
Good morning.
All right, so this agreement has to do with, remember in February, you approved my distribution and my grant application to Department of Finance Administration, and this is the contract for that agreement. I applied initially for $105,000 in the grant. We were approved for $95,000. So, meaning we had to slash $10,000 from something. So there's only three categories in the grant agreement that we use. Payroll, Quarter Cantinas is in there, and then contractual for treatment services. So after much discussion, the Planning Council voted to slash the $10,000 from the treatment area, only because many of our clients are Medicaid eligible now, more so than has been in recent years, and so those treatment services can be covered under Medicaid rather than just our program. And so that seemed to be the best area to slash it from versus Quarter Cantinas slashing $10,000 from that budget, and of course my payroll services. Know that also there was Senate Bill 413 that impacted our distribution amount also. The distribution doesn't have a contract because each county gets that by law, and that doesn't have to have a contract. But Senate Bill 413 reduced the amount of taxes per gallon or per liter that some breweries on a certain alcohol, and I can't remember which one it was, but it greatly reduced it. Enough so that all counties in New Mexico where our budgets were reduced by about 5%, almost 6%, meaning we lost $9,000 from our distribution funding also. So we slashed that out of enforcement for now. I have an excess from this year that will be returned from next year, so we can decide where we're going to put that. But that is what is on what you will be hopefully approving on Thursday, is that grant contract that is effective July 1st. And I stand for any questions. No?
Thank you.
All right, thank you.
Thanks. Thank you.
Item H, consideration of agreement A 1925 between the State of New Mexico Tourism Department and Grant County Commissioners Lodgers Tax Committee for marketing and advertising grant for fiscal year 2019-20. Lodgers Tax Board applied for this grant. It's a cooperative marketing grant that they apply for each year. They were awarded $23,466, and we would request your approval. Questions? Moving on to resolutions. Item I, consideration of amendment to Resolution R-1740, correcting designation of the polling places for the 2018-19 primary and general elections. I can tell you nothing about this. Sorry.
Except that's related to the issue of heating a building out at the fairgrounds? Is that what I'm hearing? Is that the same thing?
I think one of them may be designating the location of election day polling places, which is item L, I believe.
I see. Okay.
But she is not able to continue to use the school, especially with the new election code, because elections may pop up that she may or may not have to do, and because of the increased security at the schools and how that you access campuses, she requested to utilize this building as her polling location for the Cliff, Gila, Buckhorn, those precincts.
So should I wait for that item? I should obviously wait for her in any case on Thursday. But there are other options out there.
That was going to be my
That
question.
wouldn't require
There'll be
heating
a
an
place
enormous
that wouldn't.
building.
Yes. And my question would be, is that going to change our use of San Lorenzo as a polling place? If it's
Right, you would think it might be the same thing.
I can't answer any of those.
Perhaps
She just approached us
the
several
two
months ago
districts,
about that and not.
They might have different security policies that make San Lorenzo still okay, but Cliff not.
We can ask those questions on Thursday, I guess. Or before, yes. Go over.
Yeah, right.
So I'll move on to item J, consideration of resolution R-1936, authorizing and acknowledging the terms and conditions of a grant agreement by and between Grant County, New Mexico and New Mexico counties for the 2019-2020 Community Wildlife Protection Plan Wildfire Risk Reduction Grant Program. Randy and Nisha both already talked about this. This is the grant for $15,000 to update the plan. Item K, consideration of resolution R-1937, establishing new precincts in Grant County. Can't answer anything with this either, unless you want to chime in, maybe.
Mr. Chairman, Commissioners, just that I'm familiar with these in the past, and I've reviewed the current ones just to match up with the statutes. It's all legal, but I don't know the reasoning behind the changes.
Next, item L, consideration of resolution R-1938, designation the location of election day polling places for all statewide elections conducted in 2020 and 2021, appointing the board of registration members for the county. Is this where you wanted to add something, Commissioner Brown?
Did I?
Regarding locations, you said there's other locations other than.
Well, yeah, but I was going to ask. Okay, I guess we can have the discussion. I don't know the area as well, and what would be an appropriate location for polling. But there's, for example, the Senior Citizen Center in Gila, not in Cliff, and you're shaking your head.
Because AAA, because of the regulations around funding with senior centers, is to be used for senior purposes only. They strongly just, no, we can't use it for community meetings, we can't use it as polling locations, we can't,
What if it helps seniors vote?
Well, it's just the regulations that come along with the funding, that it is for seniors, it's for senior meal site, they're very specific, and we had to cut out a lot of extra activities that were happening at the senior centers in regards to the rules and regulations that come along with that money. So I don't believe that's an option, but I can make a phone call and ask. But I don't believe.
Well, I don't know if it's your job or if it's Marissa's, but
The issue
Well,
will be.
Marissa wouldn't have the contact for
Okay.
AAA, and they won't let us do a lot of other things, and especially if I understand where you're going with that, but I don't believe that they're going to allow us to use a senior mill site for a polling location.
So they would potentially allow that if the polling didn't have to start at 7 a.m. and last until 7 p.m. So technically, the center could only be used for senior-related things during their open hours. So either 8 or 9 o'clock in the morning when they open to start the meal until it's done. So it couldn't be used for polling during that time. And so if your polling hours are 7 to 7, then you're violating that regulation.
That's one of them.
See, but I was also thinking about fire stations. If maybe the fire station could be used as a polling place.
Or what about the community building?
The community building has its own set of issues regarding code that we shouldn't actually be using, and it's tiny.
Is that the Quonset
It's
hut?
the little Quonset
Yeah,
hut.
it's the Quonset hut. Yeah.
It's
The fire station.
not handicap accessible either, and
That's right.
it's, and then the fire stations, you want to add into why they don't let us do other things there?
Well, I don't know, I have to check with the chief, but, I mean, obviously, it's a firehouse, and so if activity breaks out or there's a fire, then, you know, you're gonna have an issue there. I'm trying to recall whether that has some ADA compliance issues on it as well, friends. I think it does, so that might be an issue as well. Parking would probably be another issue, because the parking area, you start blocking fire trucks, and where do we move those, and how do we move those? So logistically, it would be an issue.
Okay, how about a tough shed in the community? Because, I'm thinking about this heating that building, so.
I'm trying to think of that quote, and I want to think it was $5,000 or $6,000. It wasn't like 10.
So they're gonna have to all stand around a campfire?
No, it's actually, the difference in that building is it's very well insulated. It was built for people. It's insulated. It actually stays fairly cool in the summer months, just as, they do crack the doors. I'm just saying it's insulated, and you don't see gaps of air like you do
in the
pavilion. There's a little bit of a difference, so.
No, but if Randy alluded to ADA, is it ADA compliant?
There are ADA parking spaces. I did look at that because that occurred to me. I did look at that. There are identified ADA parking spaces, but that's Marissa's to look at. She's the one that requested us to use this building. We moved forward trying to accommodate her request to use this, and she's the one that has to determine whether or not it meets those requirements for her to use it as a polling location. So that would be a question for her on Thursday. I can't recall off the top of my head whether there are or not.
Well, and as far as the heating issues in that building out there, if people start using the heat, I guess management can look at that bill and add some onto the rental if you promise to rent it and not use the heat for a winter dance or whatever. I know I dance out there, I create my own heat, so I really don't want heat in that building. It'll be so hot I won't be able to dance. So that I think management can hopefully handle that one. The food distribution services, I know some of those people really like heat a few days, but
yes, they would.
The cost of paying for it,
They're actually very good tenants.
Okay, good.
Okay, item M, consideration of resolution R-1939, a resolution to enter into a cooperative agreement between the County of Grant and New Mexico DOT for Project CAP, year 2019-20, to patch roadways, overlay, lay single penetration chip seal and drainage, shoulder improvements, and striping of roads within Grant County. Total amount is $198,245. It's a 75-25% split. 75% comes from DOT, 25 from the county, and we utilize in-kind labor and equipment for that. Do you want to chime in on what you're doing with that?
Yeah, this will be the regular rotation for chip seal jobs. I did warn you on that resolution and on resolution O. Those were based on the funding that I got last year, and that's what they told me to use. And as you know, our funding got cut this year, so we're looking at again next year, cutting probably 5 miles of road out of this, unless the oil prices go back down. On there, I did want to leave all the roads on there, so when next year rolls around, I can go look and we'll pick whatever's the worst ones to be able to spend this money and do on there. But we will look at probably having to cut 5 miles of road again unless oil prices go back down. And I won't know that until April of next year.
So one thing I don't understand is cutting money for that. I mean, there's always discussions about economic development, doing this, retirement communities, and what's one of the first things that people see when they come into a community? Is the roads, but hey.
And we're hoping...
I'll leave it at that.
And like I said, if we're hoping if we get, the money for Hurley over there, because that's one of the roads that was on there, it's reserved until we do get the money. So if we get it, that's going to help out a lot with Commissioner Brown and wanting to look at widening Ridge Road out. I'm looking at maybe taking that money off of there and putting it someplace else also. And then figure out something we'll have to do. It'll have to be something different than chip sealing to widen that road out up there. So there's things that I'm looking at. But like I said, what's going to control it will be the oil prices.
So the money that's being cut, that's maintenance money.
Yeah.
Right, not construction.
Right.
And widening a roadway to provide safety for bringing things to landfill or the detention center. Wouldn't that be new construction money?
Well, yeah, and that's how I say I'm going to look at different funding sources, but if I can't find any, I'm going to have to use the LGRF to do it. I'll just have to get creative. It might have to be something done in 2 phases.
And I don't follow this that closely, but I feel like I've seen headlines about the state having more money for new construction of roads, not less.
I don't know what they're doing with that money. I mean, if you even look at I-10 between Deming and Cruces, and they tell me it's all the way to the state line, that's the worst I've seen that interstate.
Yeah, it's bad. It's really bad.
I don't know what they're doing with it.
So that's perplexing to all of us, is because we were expecting to have more money. That was the discussion the entire session. There's more money, there's more money. And then there ended up being less money, and we're looking at less money next year. So it doesn't really make a lot of sense. I've had conversations with Senator Ramos and Representative Dow, just very informal, but I think we need to really maybe take a look at that and maybe lobby that a little harder in the future. The $50 million, I don't know if that's the 2 projects that we applied for. I don't know if that's their extra money and they're trying to look at different construction projects, but there's really no logical explanation as to why we received the cuts we did to LGRF.
Okay.
Item N, consideration of resolution R1940, a resolution to enter into a cooperative agreement between the County of Grant and New Mexico DOT for Project SP year 2019-20 to install an 80-foot prefab bridge.
Mr. Chairman, Commissioners, this is just, after getting it engineered and everything, we realized we weren't going to have enough money, so I had to ask for more money to complete this project. I'm still looking at trying to get that thing done this fall. Stantec's working on the engineering part of it, and when they get 60% complete, they're supposed to get a hold of me and take a look at it. And once we get it, it'll roll pretty fast.
And this is a project in Commissioner Billings' district, is that right, down past Tyrone?
It's off the Ridge Road. It's a Tyrone access that goes over towards the mine over there.
Okay.
The DOT deemed that bridge unsafe on there. And I just actually got another report on it this morning. They're really after me to get something done on that thing.
And we actually have this on our bond project list. If we come up short with DOT monies to supplement whatever we need, because it is deemed unsafe, is also on our bond project list, because we know we have to get it done before they close it.
They're almost to that point. And I've been putting them off. But I did get another report this morning, and I did respond to it. It's in the process of getting something done. Hopefully by this fall we'll have something done. I have already built a detour. It's closed off right now, but I did build a detour over there in case something happens. They do close it off. We'll have something there to get people in and out. It won't be very feasible for trucks, but people will be able to get in and out there.
So basically, it's a safety issue, right?
Yes, sir.
Yes, that's fine.
Thanks for taking the initiative to do the detour.
Yeah, appreciate that.
Moving on, item O, consideration of resolution R1941, a resolution to enter into a cooperative agreement between the County of Grant and New Mexico DOT for Project SB, Project 2019-20, to patch roadways, lay single penetration chip seal and drainage, shoulder improvements, and striping of roads within Grant County. SB does stand for school bus, so these are all school bus routes.
And it's the same thing. It's got quite a bit of roads on there. Like I said, it was used for the funding that we had last year, so there'll be roads that'll have to be cut off there too. I'm hoping oil prices go down and everything. I'm kind of reading now that They're saying oil prices are starting to go down, but they're locked in at that price right now until next April, no matter what.
Item P, consideration of resolution R-1942, a resolution of the Board of Commissioners of Grant County, New Mexico, authorizing the submission of a New Mexico Community Development Block Grant Program application to the Department of Finance and Administration, Local Government Division, and authorizing the Commission Chair to act as the county's Chief Executive Officer and authorize representative in all matters pertaining to the county's participation in the Community Development Block Grant Program. All of that to say that this authorizes the submission of a CDBG grant application and authorizes the chair to be able to sign all documents related to that application. I held 2 public hearings as required for the grant process. Yesterday, I had 2 people show up for the morning, one of those being our assessor, and I had 1 show up for the afternoon, and that was Commissioner Edwards. Not a lot of turnout. So projects that were identified, supportive housing, Christina Wolford with SPEN and her project, and also Raul's asked about a pictometry project, which I don't think would qualify, and we talked about this, I don't think that would qualify under a CDBG grant. It's more for infrastructure type, but I told him we could definitely look at a planning grant application in the future to get started as looking at the study and the feasibility of moving a project like that forward. I think it's a great idea, and we can certainly look at other funding sources, but we could look at a planning grant later on. I was asked if there was any other projects being discussed. I did mention the town park, because there was no one else there to mention it. So I did mention that we had those discussions. And so that was the extent of those. Looking back, there was a joint public hearing that was a post-project public hearing, and one held in January. And there was 1 person showed up for that as well. And mainly it looked as though he just asked some questions about, he was trying to educate himself about what CDBG was. So nothing really came out of that hearing either. So we have now met our obligation for pre-project selection public hearings. Based on your decision on Thursday to approve this resolution or not, we will host another public hearing on Friday morning that is a post-project selection public hearing stating that this is the project you chose, and I'll have to explain why you chose that project. So,
okay.
That's it. Unless you have any questions. No. Item Q, consideration of resolution R-1943, declaring an emergency and requesting emergency funding for the Hanover Mutual Domestic Water Consumer Association. Approximately a week ago, the Hanover Water Association had trouble with their wells went down. The county has stepped in and helped them in the past. As you know, Hanover's not an incorporated municipality. They're part of the county. The Water Association has very limited resources. We've helped them in the past. This is a similar effort to help them through this. We did rent a generator to get one of their wells up and running so that they can fill their tanks. They did tap into, they have an emergency allotment that comes from the city of Baird, but that's capped, so they did utilize some of that. So what this resolution does is declares an emergency and allows them to apply for emergency NMFA funding for water issues such as this. It's just a resolution saying, yes, there's a problem. We would like for them to receive any possible emergency funding to rectify the problems that they're having.
So they have an inverter problem, right? Or they have some piece of equipment that needs to be made in order to work. And this resolution would give them the authority to go to the NMFA, say it's an emergency to get this done so they can shorten the process of getting the funding from NMFA to do it. And what we're going to do in the meantime is pay for the generator to keep the tanks filled, right?
That's correct. And where when I talk about their limited resources, in order for them to fix this problem, it depletes their entire amount of reserves. So they're looking for this emergency funding so that they don't have to deplete their reserves and they can continue to operate until they receive more funding.
What is the typical turnaround time on an emergency request to NMFA? Are they pretty quick? Because, the state, as we know, can be abominably slow on stuff. Do they turn them around pretty quick? What?
Mary Alice couldn't hear you.
Sorry.
I can't answer.
I asked how quick NMFA would get that money to them.
I can't answer that question. I'm not familiar with the program. I don't know.
Thanks.
Is there any other comments or questions on that resolution? Okay. Next section, bids and requests for proposals. Item R, award reject RFP 1905 Airport Engineering Services. Is that what you're here for, Randy? You want to talk about it?
Good morning. Good morning. In your packet, you have a letter of recommendation from myself regarding an RFP that we put out for airport engineering services. We had two firms submit a proposal to us, one being Armstrong Consultants and the other Bohannon Houston. As you can see, they scored fairly close, but Bohannon Houston came above just based off of past experience and their work with the county. So this is for your award or rejection on Thursday. If you have any questions.
No, thank you.
Thank you. Thanks.
That concludes your agenda.
Okay. Moving on to the next item on the agenda, Commissioner reports. Commissioner Brown, do you have a report?
It's less a report than a public apology. And I'm apologizing to our county attorney because I contributed to leaving an impression, and this was brought to my attention by a number of people, that there was an issue, that we were dissatisfied, and that's what led to the resignation. When we accepted your resignation, I think there was silence out here, and I, for one, wasn't quick-witted enough to thank you for your service and to tell you I've really appreciated everything you've done. I've really enjoyed coming into your office and talking. Actually, I love talking law, and I have enjoyed doing that, and I've found you to be very helpful to me. And so I'm apologizing for not having made that statement at the time. I was fully focused on what we were going to do next, and I apologize for that oversight. Other than that, I have no report. But thank you, Abby.
Commissioner.
Well, I didn't have a report until you said that, and I'm just like, wow, I never thought of that either. So my apologies for being even more asleep than Harry was on that day. And yeah, I would just reiterate that absolutely you've been an asset to the county and so helpful to me as a commissioner. Thank you very much.
Thanks. Yeah.
Commissioner Summers?
Well, I also want to mirror what Commissioner said, and I've talked to Abby personally, so. But there's another issue that I wanted just to bring up as a topic of discussion, because I had a phone call that told us that we were trucking some water to the arena, and the person asked me if we should be doing that. So I don't know if that's something we just talk to our county manager, or if that's something, a policy that we need to address. Because I can see where if we're doing services for one group, then another group might come and say, well, I want you to utilize your equipment to grade a parking lot, to help us do some gravel, something like that. So I wanted to open it up for whatever you guys thought.
Can you explain? Mr. Chairman, Commissioners, I can explain why it's being done. It's not for a specific group. It's because it's a county facility. And in order for someone to utilize that facility, it's dirt, it's hard. In order for someone to utilize that facility for an equestrian event, which is what it was rented for, if there is no moisture in the ground, I have asked the road department to haul water when he is available to wet the ground. We don't do anything beyond that. That person, if they need additional water, they use sprinklers, they use water hoses. They also have to hire someone or use their own equipment to till the ground to be able to utilize it. It's part of preparing a facility for someone to use, just like if we rent the pavilion that we have trash bags and the floor is clean. It's part of having a facility prepped or able for someone to use. If we want to discontinue this, then I can tell you that it won't be used in the future.
What facility are we talking about?
It's the county arena that's located on the fairgrounds property. It's rented from time to time in Cliff. It is rented from time to time. There is an individual that rents it and hosts a series of barrel races. That's what it's being used for. I looked at it as it was part of the county having the facility able to be used. I didn't look at it from, is it for a particular group? It wouldn't matter who it was that wanted to use it. That was the logic behind it. However, like I told Commissioner Salas, if that's an issue with the board, please direct me and I will do otherwise. But I would expect you're going to receive some phone calls from the constituents out there that utilize it just like other facilities are being utilized for in other.
So do we have I don't know if policy is really the right word that I'm looking for here, but a set of directives or an outline of what we're going to do. So we have county facilities that we rent. And those facilities are things like Baton Park, the facilities out at Cliff Gila, the convention center, that sort of thing. So they all take a certain amount of prep in order to make them ready for the renter, correct?
Correct.
So do we have a set of directives or policies that identify what that is for each of those facilities that we follow?
Obviously the conference center is a little bit of a different beast, and yes, it's very clear what you get whenever you rent that. For the rest of our facilities, those agreements and those expectations of what you expect are, in my opinion, a little vague and probably need to be reworked to where you specify that yes, you're gonna find a clean facility with adequate cleaning supplies, trash cans, chairs,
heating, cooling.
Yes. So for those facilities, the only other two, we have the conference center, which has a very detailed set of policies. But the other two facilities, so I'll use Baton Park and the fairgrounds, they're a little vague in my opinion, and they don't really spell out what we will do or what we won't do for those. But like I said, it was just an effort to make it to where it could possibly be used for someone.
And we rented we rented the arena, that's why we watered it.
I feel like, Commissioner Salas, you've had this explanation, it sounds like, Manager Webb said she mentioned some of these things to you. Is there something in your mind that makes this an unusual situation? Normally I wouldn't want to get into these kind of details of county operations unless we think there's malfeasance going on.
Well, it's not the issue of malfeasance. What the person mentioned to me was, the use of county equipment. So if it was, the use of county equipment was going to be made available for other things,
But it's being there's no sense it's being used on for private interest, right? The county equipment's not being used to maintain someone's personal house or grounds or anything like that, right? Because I think we use county equipment on county facilities all the time. I'm curious what's different about this.
Well, they said because it was the hauling of water, and with water already being there. And also they asked me, well, does the rental of the facility cover the cost of what it costs us to put water out there. But certainly we sent a truck from here over there, and it probably made various trips.
Well, that's a reasonable question.
I can explain that a little further. The water is actually donated by a gentleman out there. We're not hauling water from Silver City to Cliff and making multiple trips. We're making one trip. Is Mr. Dickerson's a quarter mile, maybe? So the water's donated. It's one trip out there. My other thought behind it too, we continually get dinged by the union that we don't provide any training for truck drivers. We were utilizing this as a training opportunity to get them on a truck as well. But it's we're not hauling water from Silver City to there,
we're utilizing
county equipment. We're using county equipment on a county facility.
Under a rental agreement. That has a rental agreement.
Does that agreement?
But does it cover the cost? I have no earthly idea, but, and that's part of, and as I've been thinking about this and what the expectations are, we're probably going to have to look at increasing the rental rates on all of our facilities. I know the conference center is working, but the other two, perhaps those rental rates are going to have to come up as well, looking at, really doing a cost analysis of whether or not we're making any money or not. But I don't know what it costs to make one trip. Wrong trip. I don't know.
When we went back to, and I know this is a work session since this came up, but I think it would be a great idea for us to really look at what we rent out places for. We need to look at, what costs are associated with renting as far as cleanup, bags, water, whatever it may be, because, looking at what we're trying to do about Town Park, we're trying to get it ADA compliant, the discussion about the heater, the cooler, maybe it is time for us to go revisit to recoup some of that. And I hate to put it that way, but to recoup some of that cost.
That's our job.
Some of these things, because Commissioner Edwards brought up a valid point, Commissioner Salas brought up a valid point. If the water's being donated, we're good with that, but, there still is man hours. We're paying somebody. There's still equipment, gas, maintenance of equipment. I'm not going to get into all that, but, we really need to look at it down the road, look at our rental agreements and what should be in there and what shouldn't be in there.
And Kevin and I are going to start working on that. We're going to be looking at other counties that rent similar type facilities. We'll be requesting some policies, taking a look at that, trying the best we can. We'll work with Jason and Earl as far as what the cost of those services are and make sure that we're covering, because I'm sure that we're not covering all of our expenses. That's just a guess on my part, but they're rented very cheaply.
And that word perception, what people perceive and what they, do bring up concerns, it's a big word. And I think if we take the opportunity to define what we're going to do, go from there, I think it could help with some of that perception. Because, I've said hearing this, I had probably the same question as Commissioner Salas had, is, hey, what are we doing here? And are we being fair and consistent? Are we doing that? But, that's all I'm going to say about it.
Well, I think sometimes we're not going to recoup our costs, but still, I like your idea of a plan. And I think we need to have some questions answered to make a good decision. Sometimes it might come down to the ratio of dollars spent for people served. So you mentioned, originally said something about an individual renting this, which raised a red flag, but then you said it's for an event, so that relieved my mind some. So it looks like some people are, it's not just an individual, it's a group using it. But still, I think we need more information. And I like the idea of a plan looking at all the facilities.
Well, I don't know that we could get into a cost per, because how would I ever know how many people go and use the baseball fields?
No, and I mean that technically. We're going to have to shoot. We're going to have to shoot from the hip on that. But when you're renting a facility for, I don't know, I'm just thinking 200 people show up or 100 show up at an event, and it's X amount of dollars. You can just kind of shoot from the hip and know if a dozen people are renting an event and it's costing the county a lot of money. I don't know if, like I say, just shoot from the hip and realize we're spending a lot of money serving a few people. And I'm not suggesting that's the case here. I don't have enough information to know.
Well, I think we have to really look at you're right. I mean, we're going to be shooting from the hip. We're not going to be able to, okay, well, if we rent a table, they're going to need 3 water trucks to get it. Well, but I think we can, like the heating, cooling things, trash bags, I think we can get a good idea of where we may have to be in going from there. But it's going to be hard to put an actual price on it. So.
And it's going to bring a little bit of clarity to the issue because, I certainly don't mind that arena being used for an activity that is in that environment. I mean, you're going to go out to that area, horse riding, barrel racing, and that's part of what they do. And it's going to be, like a quality of life thing. But if we're going to do it out there, let's have a policy for, as Chris was saying, let's just review it. And this gives an opportunity to do that. And that's good.
I would just comment on the idea that, there is a rental fee, whether there's 1 or 100 people there. It doesn't have anything to do with the people, it has to do with the facility. And so it doesn't matter how many people ride in the arena or hang out in the pavilion or whatever, it's a facility rental. And there are certain things that we need to do in order for that facility to be ready for whatever activity that facility is appropriate for. And so water on the ground at the arena and cliff is different than whatever we would be doing at Baton Park to make sure that it's ready. The key is it's a facility and there are a certain minimum number of things that have to be done in order for that facility to be rentable. Whether it's 1 or 100 people.
And I think that's what breaking each individual facility and what it brings to it is probably something we can look at.
Well, and I would just remind us, we had a lot of conversation about this when we figured out what the fees were going to be and the policies were going to be for the conference center.
Yep.
So
same idea.
Same idea.
And I brought it up because I didn't know this is just something we could discuss with the county manager and look at it, or if this would entail some kind of a policy decision.
I would just say that I think this is the kind of thing that, in my opinion, is the county manager's job in terms of, we have some constituent brought a concern to me, we need to evaluate this. And then have the county manager bring us the results.
And I did go to the county manager. I just want to be correct in what I do. Thank you.
I think it's great.
Did you, anything else on the commissioner report?
I'm fine.
Commissioner Williams?
Nothing. Thank you.
Wow, I got sidetracked there, but thank you for your services. I appreciate it. And same with these other 2 commissioners that we overlooked that last meeting. But thank you for everything that you've done. And I know with the 2 new commissioners, only been here, what month is it? June, 6 months maybe. But you have been a great help. So we really appreciate it. Thank you. That's all I have. My report. So,
Mr.
I
Chair.
thought these were supposed to be cut down in time, but...
Hey, it's not noon yet.
It's a work session.
It's a work session.
It's a work session. Thursday's meeting, we're going to go
Fly through it.
except for the county clerk's part.
See, I'm trying to keep it at least going till noon so we don't start now.
Is this executive session necessary today? Well, I'm looking at, I haven't switched back yet.
Yes.
Phew. Before noon, you did it.
Yeah, I did.
We just need a motion.
Mr. Chair, I move that we go into an executive session in accordance with...
No.
So you're doing the same thing I did.
That's Thursday.
That's Thursday.
This is just...
Oh, I move that we adjourn.
All those in discussion, all those in favor?
All right.
Motion carried. Oh, sorry.